Okay, everybody. Well, welcome. This is another session for the Medina Clinic's medical education series. The mission of the Medina Clinic is twofold. One is to provide charitable primary care to those who otherwise may go without, and the second is to provide educational opportunities so as to help volunteers and students move on in their graduate medical education um, process. So this medical education series is part of that mission. So today's topic is domestic violence, and these are our participants for today. Of course, we may have more depending on if other assistant physicians decide to join in. It's optional. They can join in if they would like. So welcome to others who decide to participate. So so today's topic is domestic violence. So we could just jump right into it. Let's pretend we have a 25-year-old woman with pelvic pain, low back pain, insomnia, and fatigue. So a 25-year-old woman comes to the office for a new patient visit. Her complaints are 6 months of constant pelvic pain and low back pain, intermittent myalgias, insomnia for many years, and feeling tired. When you ask about bruises of varying ages on arms, legs, and face, she notes that she is clumsy and bumps into things a lot. Her husband accompanies her to the visit and refuses to leave the room for the physical exam. On pelvic exam, purulent cervical discharge is noted, along with cervical motion tenderness. Her husband inquires as to why you are using so many tubes for laboratory specimens. Okay, so number one, which of the following should be considered to be part of the differential diagnosis in this patient? What would you guys say? Is it A, intimate partner violence, B, pelvic inflammatory disease, C, pregnancy, D, a bleeding disorder, or E, all of the above? What would you say?
I would say E, all of the above.
Okay. Anybody else?
Say A.
Okay. All right.
I'll say A.
A, okay. All right.
I'll say A.
A, okay. I would, personally, if it were me, I would probably say, well, if I go through it, intimate partner violence, I mean, that's what the topic is, right? So certainly it makes sense to have that on your differential. Pelvic inflammatory disease, I think we're obligated to have it on the differential because it talks about purulent cervical discharge and cervical motion tenderness. So that's fairly significant. It's not something that is super common necessarily. So I think you're sort of obligated to have pelvic inflammatory disease on your list. Pregnancy, I put a pin in that. I think B more likely than C. D, bleeding disorder, certainly when it talks about bruises of varying ages, it's talking about a differential, not a certain diagnosis, but a differential. So I think D, you kind of have to think about. So for that reason, I would just go with E. So if we look at the answer, hang on one sec. Let's see what it is. So yep, it's E. So, yep, it's E. So as far as the answer here, this patient has evidence of pelvic inflammatory disease, right? You don't want to ignore that. Cervical discharge and cervical motion tenderness, okay. And has multiple bruises of varying age. Although a bleeding disorder could be the cause of bruises, she also has evidence of sexually transmitted disease, a partner who shows signs of mistrust of the physician, and bruises that could be associated with multiple injuries. She is of reproductive age and has evidence of STD, so pregnancy should also be considered. Okay, and that's a good point. A patient comes in with chronic pelvic pain, certainly a pregnancy test would be warranted, so that certainly makes sense. Patients who are victims of intimate partner violence often present to the physician not with this complaint, but with complaints of fatigue, insomnia, or nonspecific complaints. So I think in the primary care setting, this is a very important thing to think about because, you know, a lot of times we always say how, you know, patients come in, they come in with many things they want to discuss. And sometimes it looks like this. You'll have a patient saying, I have pelvic pain, I have back pain, I have insomnia, I have fatigue, I don't feel well. And, you know, it's a long list of things. So it's important it would be of good service to the patient to consider intimate partner violence on the differential. And sometimes I think we're so focused on, okay, let's try and address these multiple issues. We may overlook this possibility. That's why this question is a very good one. It's a very good question because it talks about, you know, having an adequate differential. So, okay, any questions on that? All right, guys, we'll move on. And just because this is being recorded, I'll just say that, you know, I unfortunately, despite efforts and being vaccinated, I unfortunately acquired COVID. So I'm hoping that it resolves soon, but just wanted to proceed forward with our session today. So the session today may not be as exciting and energetic as some of our last ones. So please bear with us on that. Okay, number 2. This is a good question. What is the estimated lifetime prevalence of intimate partner violence in the United States? What would you guys say? What would you guys guess?
B.
What was that?
B.
B, okay, it's reasonable. Dr. Abir?
C.
C, okay, 1 for B, 1 for C. Anybody else? B?
B, yeah.
B, okay. A couple for B, a couple for B, 1 for C, good. Anybody not vote yet?
Maybe C?
C, okay, 2 for B, 2 for C, okay. So if I approach this question, you know, a lot of times this has to do with test taking, you know. So one thing I would just say, remember with test taking, there are many times you just don't know the answer, but you know something, so use that something to try and derive the answer. So if I look at this, I say, okay, this ranges from 1 in 100 to 1 in 3 or 4. So I think that probably the question wants to make a point. The question probably wants to emphasize how common this is. You know, so that's one thing that I think I know. The other thing is that I recall, you know, in taking care of prenatal patients, that it's not 1 in 100. It's a lot more common than that, you know. So you know, it's really like, you know, I want to say it's 1 in 25 or more, based on just on some experience. So I think for me, A, I don't like too much. B, I don't like too much. It's either C, D, or E for me. And if it's C, D, or E, well, I know it's, you know, I know that the question wants to make a point that it's common. The other thing is 1 in 3 or 4, that's awfully specific. If it were a wrong answer, and I don't know the answer, I want to just say, I don't know the answer to this question. But I'm just thinking 1 in 3 or 4, that's an interesting way to word it. You know, if it were a wrong, you would just say 1 in 3 or 1 in 4. You know, why would you say 1 in 3 or 4? So for these reasons, I might go with E. It makes the point how common it is, and just the way it's worded is sort of suggestive. Okay, guys, ready to look at the answer? I actually do not know the answer, so we'll see. All right, number 2. Oh, number 2 is E. Okay. Let's Okay, so you see, it's possible to get the answer even if you don't know the answer. Do you see what I mean? That's an important approach in test taking that I just want to suggest. Okay, 2. Let's read the answer here. According to the National Intimate Partner and Sexual Violence Survey conducted in 2010, 22.3% of women, that's 1 in 4, and 14% of men, that's 1 in 7, age 18 or older have been victims of intimate partner violence in their lifetime. 14% of women and 3.54% of men have been injured as a result of intimate partner violence. In a 2010 U.S. Department of Justice crime report, it states that 241 males and 1,095 females were murdered by an intimate partner. So that just goes to show, how common it is. So, okay, guys, any questions? No? Okay, let's move on. Number 3. Which of the following is not a characteristic of intimate partner violence? Is it A, highest rates of intimate partner violence occur in Hispanic couples? B, violence behavior in the family of origin of either or both victim and batterer? C, high risk of suicide attempt or gesture in the victim? D, results in nearly 2 million injuries and 1,300 deaths in the United States? And E, association of this condition with poverty. Okay, guys, give it a shot. Which is not a characteristic? What would you say?
I'll go with the A.
A, okay. Good. It's an interesting one, interesting question. Okay, the rest of everybody, what do you think? You have 1 vote for A.
I would say B.
B, okay. Okay. Now remember, it's saying which is not a characteristic, right? Which is not a characteristic. All right, Dr.
Okay,
Tahani.
so I will choose A.
Okay.
We choose A.
A,
Choose B.
okay. Okay, so it looks like we have, sounds like 2 for A, 2 for B.
C.
Oh, we have 1 for C. Very good. Very good. Okay. All right, let's take a look here. Let me give it a shot. So, which of the following is not a characteristic? Okay, so A, highest rates of IPV occur in Hispanic couples. So I don't know. I don't know if that's true or not. I guess I want to be cautious about that one because, one thing about intimate partner violence is we don't want it to be something like, I don't know, stereotyped or stigmatized in some way. So I don't know. I'll put a pin in that. B, violent behavior in the family of origin of either or both the victim and batterer. This is something I can see being a feature of intimate partner violence. If this is something that was previously experienced in the, in the previous family of either person, of either partner, I can certainly see how that's a risk factor. So based on that, I probably wouldn't pick B. C, high risk of suicide attempt or gesture in the victim. I don't know, but I can see that being the case. I don't know for sure. So if I take stock of where I'm at, I'm looking for the one that is not consistent with IPV. A is the one I'm most suspicious about. C, that's the one I'm second most suspicious about at this time. B is I'm least suspicious. I think B is a characteristic of IPV, I think. Okay. Yeah. So let's go to D. Results in nearly 2 million injuries and 1,300 deaths in the United States. I don't know. You know what? Because I don't know, sounds good to me. I think it's more likely to be correct than incorrect because I just don't know I don't know if it's true or not. So I don't have enough information to overturn it. So far, A is the most, for me, is the most inconsistent one. Now, E is interesting. Association of this condition with poverty. That's very interesting. I think based on what I know about intimate partner violence, it's not really something that is only in the poor. People well off can be victims of intimate partner violence. So when I look at A, for me, like E is the one that I disagree, like I most strongly disagree with. More so than A. Now, A, again, I don't know, but I always want to be careful to stigmatize and stereotype, but it's possible. A is possible. E, I don't know if it's possible. I mean, I think I just have a lot more doubt about E. So I think I'd probably pick E.
Hey,
Oh, somebody. Looks like we have
because we're gonna have this dad.
another participant disagrees. All right. Let's take a look, shall we? Number 3 is, it is A. Good job, you guys. You guys did well. It is A. All right, you guys did good. Let's take a look. Rates of incidence of IPV are high among minority groups. However, rates of IPV between Hispanic and Euro-Americans are similar, although rates of IPV for African-American couples are nearly double. Oh, I think I even, you know what, you guys, I think, yeah, okay. How about, so did you guys catch that? So the rates of IPV are high amongst minority groups. However, the rates of IPV between Hispanic and Euro-Americans are similar, although rates of intimate partner violence for African-American couples are nearly double. The Journal of Trauma, Injury, Infection, and Critical Care in 2004 reported the statistics in Choice B, emphasizing the importance of suspicion for IPV in assessment of injuries, as well as the need for primary care follow-up. Women who are victims of IPV, excuse me, are indeed more likely to be diagnosed with depression than the general population. Although IPV can occur to any woman or man, studies have indicated the following as risk factors. Age, with most IPV occurring before age 25. Low verbal IQ scores. Unemployment. Financial stress. Victims of child abuse, and witnesses of IPV in the household as children. Men and women perpetrate IPV at similar rates. Some studies suggest women perpetrate IPV at higher rates. However, IPV perpetrated by men is more likely to inflict injury, where 62% injured by a partner are women. So, okay, guys. So I think we got our answer here. Learned a little bit. Any questions on that?
No.
Okay. So almost there, almost there. Good job, you guys who picked A. Who picked A? Did Dr. Abir, did you pick A?
No.
Oh, who picked A? I'm sorry.
I picked A.
Dr. Varda, can you share your rationale for why you picked A?
So my sister-in-law is a psychologist in Brooklyn. So once she told me that most of the patients with IPV are African Americans.
Okay, there you go. So you flat out knew it. Good job.
Thank you.
Next up, which of the following is not a common presenting symptom or complaint of a victim with IPV? What would you say?
Going with E.
E.
E, elephant.
I'll go with E2.
I also always E.
Yeah, I think so. A through D are all pretty much, there's nothing really to distinguish them. So number 4 is, yep, it's E. Okay. So although injury is a common presenting complaint in the emergency department, physicians often hear complaints of somatic symptoms in the primary care setting. That's kind of what I was getting at earlier. There are a lot of somatic complaints that get presented during a visit. When the patient is a victim of IPV, rarely is the IPV a presenting complaint. That's why it's important to have it on the differential. So good. So there are only 10 questions total, just so you guys know. So clues to domestic violence. A 31-year-old African-American woman with 6 years of education post-high school presents at the emergency department with bruises, severe pain in the left forearm, and symptoms of depression. When the emergency department calls you regarding the patient's presence, you recall that she has had 3 appointments on your schedule, but all 3 had been canceled at the last minute. Her husband is a laborer and often will not allow her to keep a physician's appointment unless he can accompany her. You indicate you will come see the patient. All right. Which of the following statement about screening by primary care physicians is true? What would you guys say? Is it A, only 15% of primary care physicians routinely screen their patients for IPV? The USPSTF does not recommend screening for IPV. Referrals to a women's shelter to ensure the safety of victims. There's something missing in that answer. Let me look at number 5. No, that's an answer. Okay. I don't quite understand the referrals to women's shelter ensure the safety of victims. Oh, okay, that's fine. It's just saying a statement of fact. Clinicians should be alert to physical and behavioral signs and symptoms associated with abuse or neglect in all patients. And evidence is clear that better intervention programs are effective in reducing rates of domestic violence. What would you say?
D. Yes,
I'm
D.
going with D.
You
D.
like? Okay, good.
I'll go with D2.
D, okay. I think there was Dr. Tahani. Did you?
Yeah, I said D.
D, I'm sorry. Okay. Okay, so everybody pick D. I'm gonna take a look here. Again, don't quite know the answer, but let's see. Only 15% of primary care physicians routinely screen their patients for IPV. That may be true if you look at everybody. The USPSTF does not recommend screening for IPV. I'm kind of skeptical about that one. Referrals to a women's shelter ensure the safety of victims. Yeah, I like that one better than C. D, clinicians should be alert to physical and behavioral signs and symptoms associated with abuse and neglect in all patients. Certainly hard to disagree with that. And evidence is clear that intervention programs are effective in reducing rates. Well, not always. I think I would also go with D. Let's see what the answer is. It is D. Good job. Okay. So as of January 2013, the USPSTF gives IPV screening of women of childbearing age a grade of B, which means there is high certainty that the net benefit is moderate, or there is moderate certainty that the net benefit is moderate to substantial. Women's shelters allow women to leave at will and do not ensure the patient's safety if they leave. Half of women asked support routine screening. Half of women asked support routine screening. The U.S. Agency for Healthcare Research and Quality notes that only 6% of U.S. physicians ask about possible domestic violence. but 88% stated that they knew of female patients who were abused. So 15% is even too high. So good. Okay, I think that was very good. Next up, so clues to domestic violence. After discussion and examination, you are convinced that this patient is a victim of IPV and recommend that she make a police report. Okay, number 6. All right, guys, I think we're halfway there. I'm gonna take a quick break. Give me about 5 minutes, I'll be right back. So while I'm doing that, go ahead and consider this question. I'll be right back. All right, guys, what do you guys think?
I'm going with D.
D, okay, very good. That's a reasonable one. What else, what do you guys think?
I go with B.
B, okay, good.
I'll go with D.
D, okay.
D too.
Okay, all
I'll
right.
go.
So the one who, so for B, who picked B and what's your rationale for that?
I pick B. I'm not sure. Yes, I guess.
It looked good, huh? Yeah.
Yeah.
Okay, let me give it a shot. Correctly matched. Rape and sexual assault, 20%. Physical assault, 50. Stalking, 80. Yeah. I wonder if you say all of the above, if it has to add up to 100%, you know? Not sure. Yeah. I think I'm more inclined to either say D or E, just because I just don't know. Yeah, they don't add up to 100. Now, you can have two things at the same time for sure. I feel like I have enough doubt about them. I may go with E on this one. So let's see what the answer is. The answer is A. Oh, none of us got it. A.
Dr. Murad.
Yeah?
I got it. Dr. Jean.
Oh, Dr. Jean. Dr. Jean is one of our assistant physicians. Good job, Dr. Jean. Very good. So, welcome. So, yeah. So 6 is A. So the US Department of Justice in 2000 reported that 32 million Americans were affected by IPV and that underreporting to law enforcement was a major issue. About 20% of IPV rapes or sexual assaults are reported to police. Oh, I misunderstood the question. Yeah, it's what percent are reported to police, not the types of reports. Yeah, that's what happens when you don't read things carefully. Yeah. So rape and sexual assault is the most underreported, and I think that's the point I was trying to make. Only 25% of physical assaults, just 25, and 50% of stalking are reported. These numbers are even lower with male victims. Okay, so this goes to underreporting. Moving on. When women without symptoms are screened by clinicians for IPV, which is true, I guess. What's your typical reaction when women without symptoms are screened? Majority become angry and say they're offended. The risk of harm to the affected patient is increased when screening is done in the presence of an abusive partner. Few women believe that screening is of benefit or that it makes getting help easier. Posters, brochures, and other materials in an office with culturally sensitive information about IPV can lead to more victims providing information to clinicians when asked about IPV, or all of the above. What would you say? What would you guys pick?
I'm going with E.
E, okay. What about the rest of you guys?
I'm going with E as well.
Okay.
I'll go with E.
Okay. All right.
It was D.
D, okay. Let me take a shot at it. So Dr. Tahani, why do you say D?
I'm between D and E, but for answer C, few women, it didn't make sense. I think much more women more than few.
Yeah, I think for me, when I look at A, the majority become angry or express being offended. Not really, not really. I think the normal thing, I think if someone is trying to hide something, they usually become angry or express being offended. So A, I would not be inclined to do. So therefore E, I wouldn't be inclined to do. The risk of harm is increased when screening is done in the presence of an abusive partner. I'm not aware of that. I'm not aware of evidence for that. C, I'm also skeptical. I would go with D. So number 7 is indeed D. Okay. Good. So the Institute of Clinical Systems Improvement discusses multiple strategies for improving the identification and care of IPV victims in its 2006 statement. The office that provides information that can be viewed in private is a setting conducive to communication between physician and patient about IPV. Screening in the presence of the abuser has not been shown to be harmful, but studies are not conclusive. Women who have been surveyed about IPV express support for routine screening and believe that screening makes it easier for victims to get help. So that's that. All right. Number 8, we're almost done. So after discussion of
Excuse me.
yeah, go ahead.
Yeah, for the previous question, Dr. Murad, they said, yeah, this one.
Mhm.
They said the majority are not angry or expressed being offended. I think that's happened, right?
No, usually not. My experience is usually not. If someone has something to hide, then that's when they usually become angry. But the majority of women who are not having symptoms, that are concerning for domestic violence. Usually screening is not something that triggers them to become angry or upset or offended. It usually isn't. So, yeah, yeah, it usually isn't. In fact, it's the opposite. If someone does become angry or offended, then that's a red flag. So, all right, guys. After discussion of involvement of the police, you explain possible alternatives for the patient, including, what would you say? Okay, guys have an answer?
I'll go with A.
A. I'll go A.
Okay, like
Yeah,
A.
A.
Oh,
Yeah, I
A.
use A too.
Okay. All right, referral to a shelter because referrals significantly reduce the likelihood of further injury. Confrontation of her husband. I don't think that's a good idea. Allowing you to take photographs in case she decides later to press charges. That seems a little funny. D, purchase of a gun. Yeah, I don't know about that. And then E, none of the above. I would probably be more inclined for A, but let's see what the answer is. 8, interesting, it's C. It is C, actually. Let's look at that. The evidence is insufficient to assure the patient that referral to a shelter or referral of her husband for counseling will reduce future violence. Clear documentation, including photographs, is important for a time when the patient may choose to press charges, even if police are not notified of this instance. It provides evidence even after bruises have healed. Purchase of a gun is more likely to escalate the violence and potentially lead to a fatal wound for one of the partners. So, yeah, and the thing about EHRs nowadays is that it allows you to upload pictures to the chart. So, all right, guys. Intimate partner violence in pregnancy. We have a 19-year-old at 32 weeks, comes in complaining of abdominal pain. Examination shows the cervix to be closed, no contractions. Bruising is present on the abdominal wall at the umbilical line. With regard to IPV during pregnancy, which is true? What would you say? What would you say? All right, you guys have an answer?
A.
A,
Piggy.
E,
Don't
A.
play.
give it a shot.
I'll
4,
pick A as well because B to E doesn't really, it doesn't make sense.
got it, okay. Oh, A, 4 to 8% of pregnant women are abused at least once during pregnancy. Oh, at least. B, I agree, B doesn't look very reasonable. C, sudden increase or decrease in frequency of visits is not related to risk. You're kind of suspicious of that one.
I'm going with D.
You're going with B?
D, doc.
D as in dog. Abusive partners accompany the patient to office visits rarely, if at all. Yeah, although some of them can be very controlling. Same-sex intimate partners are never involved. Anything with the word never in it, you're kind of worried about that. So, Yeah, I'm kind of suspicious of all of them except for A. I feel like D, you can have a very controlling partner that comes to visits. So 9, I'll just go with A. Let's see. Yep, 9 is A. The Maternal and Child Health Journal. Oh, you know, I reviewed articles for them at one point. The Maternal and Child Health Journal reported in 2000 that 4 to 8% of American pregnant women were abused at least once during the pregnancy. All other choices were false. Female victims of IPV are characterized as being overly concerned and making frequent complaints about health issues. After abuse, they may withdraw from the health system, change providers to avoid discussing the issue, or begin seeking care more frequently. Abusive partners can be male or female. They often do not want the victim to seek medical attention without their presence. A sexual relationship is not necessary for IPV to occur. Okay. So that's that. And I think we have one more. Pregnancy-related IPV, what would you say? Is it A, decreases as the pregnancy progresses? B, stops after delivery of the baby? C, is more frequent in unwanted pregnancies? D, is relatively infrequent compared with other pregnancy complications such as placenta previa or preeclampsia? Or E, all of the above? What would you say?
I'll go with C.
C?
Yeah, C.
C, okay.
Yeah.
All right.
C too.
C, okay, looks like we have a consensus. Decreases as the pregnancy progresses, I doubt it. It gets more stressful. Stops after the delivery of the baby, no. Stress, there's still a lot of stress after. Is more frequent in unwanted pregnancies, that can be. Is relatively infrequent compared with other things, I don't think so. I agree, C sounds good. Number 10 is C, good. Uh-oh. C. So violence by partners or husbands frequently begins or escalates during pregnancy or shortly after birth, especially if the pregnancy was unwanted. The estimates of IPV in pregnancy are as high as 12% to 15%, which makes the occurrence statistically more common than complications of pregnancy such as preeclampsia, gestational diabetes, and placenta previa. So, all right, guys. Any questions before we sign off?
Yeah, Dr. Murad, for me, this is my last session, right?
It may be.
Yeah.
Yeah.
Thank you so much for everything.
Sure.
Yeah, really informative.
Thanks, Dr. Samah. It was a pleasure having you. So,
Yeah.
okay. So,
Yeah, hope for you, Shifa, inshallah.
yeah, thanks. Yeah. You make dua for me. That's great. Thank you.
Yeah, welcome. Thank
All
you so
right.
much.
Thank you, guys. All right. Well, it was a
Thank you so
pleasure,
much.
everybody. Stay in touch. I'll try, if you've been on these before, I'll try and keep you on it in case you want to attend in the future. So it's optional. So thank you guys very much. Hope you have a great day.
Thank you so much. Get well
Thank you.
soon.
Thank you. Hope you get
Get
well
better.
soon.